Great to see you at our clinic. We'll make every effort to assist you in the best way possible. Thus, we aim to clarify what you can expect at the start of the process. This way, we can make the treatment process run as smoothly as we can. You know what you can expect from us and what we expect from you. Once the process starts, you and your therapist will have a treatment relationship. This means a professional relationship exists where you request help and your therapist gives assistance. We do have a practice policy, but also a code of ethics from our professional association that we must adhere to keep this treatment relation professional and safe. To work effectively on your issues, trust is essential. You should feel secure in our practice. It can help to know in advance what is normal and what is not typical, the do's and the don'ts. Let's just call them that. The foundation, as stated, is trust and safety. This means that if there's anything you don't like, you can just say it, and we can see what we can do about it. For instance, there might not be a good fit. We aim to give you the best care and will take it seriously as professionals, checking if another therapist could be right for you. We may ask personal questions to understand your issues better. Examples of these include how your life looks, if you have support nearby, but also specific questions. For TMG complaints, knowing if you use drugs is relevant. For some complaints, we need to ask about sexual activities. The questions are aimed at getting a better understanding of your complaints and how we can influence them. You're always welcome to say if you don't want to answer. We won't think it's odd. At Fysio-Experts, we don't assume you must always undress. This was quite common in physiotherapy before. But we prefer functional undressing. This means we might ask you to take off your shirt during the first examination to check your back's alignment. But you can keep your other clothes on, and this is only needed the first time. For certain conditions or therapies, it's necessary to take off clothing, like for edema therapy. But we always keep it professional. For coverage, a small towel can help a lot, and a non-intrusive sign on the treatment door can improve privacy significantly. With hip or knee pain, you may have to take off your pants. We ask you to wear appropriate clothing. This means you can wear a short or suitable underwear. In our profession, touching people is often required. This is a normal part of our job. But we understand this may feel different for you. There is no pelvic physiotherapist on our team, so we will never conduct internal examinations. Breast examinations are conducted only when indicated by our edema therapist. For instance, following a mastectomy. However, any touch can provoke a reaction. This may also relate to your history. Unfortunately, many people have experienced something traumatic in their lives. If this is true for you, you might find certain touches frightening or unconsciously associate them with something bad. For example, at the manual therapist, a manipulation can be done where you are quickly folded, lifted, and rolled back. For most people, this is not a problem at all. It provides immediate relief. But if you face something traumatic that makes you feel confined, it can impact you in unintended ways. Please discuss this with your therapist. We can look into alternatives or possibly another therapist, a male or a female. This allows your brain to connect less with what happened before. Touch happens in a professional sense and is done respectfully. As we work really close with patients, it might lead to feelings of intimacy. We care deeply for our patients, are genuinely interested, and want the best for you. We must keep our relationship professional. If romantic feelings arise, it is important to discuss this. The professional code indicates that after a treatment, a cooling off period is required. No contact between the therapist and patient is allowed during this time. This is to protect the patient. We do not share personal contact information, only a work email or mobile phone number, to make this boundary clearer. The therapist must also feel safe. This is the starting point for both sides. Of course, there are obvious rules, such as inappropriate touching from a patient to a therapist, sexual remarks, etc., which we need not elaborate on. If the therapist no longer feels comfortable in a professional relationship, this will be discussed and a solution will be explored. We hope you have a clearer idea of the do's and the don'ts. If you have any doubts, please make them known.